So I've been a surfer for over 50 years. And 20 years ago or so, I had a skiing injury and tore my meniscus. Had a little procedure done there, but over the intervening years, the meniscus disappeared, and I went bone on bone with my knee on the right side. And about a year ago, I started feeling it, and then a month or two after that, it started to be fairly intense pain, and finally, especially during hard cutbacks, I would feel it, and finally I was collapsing in the middle of cutbacks because the pain was so intense. So I go see the guy who does my shoulder, and he said, "Oh man, I can do a complete knee replacement for you in 5 or 6 years, when it gets bad enough. Until then, you're going to have to suck it up, maybe quit surfing." And I thought, that's not going to really work for me. So I asked around. I hear about this guy in San Francisco at the Stone Clinic, one Dr. Stone. Go and see him, taking my pictures, the MRIs. They do some more pictures, and they go, "Hey, you're a perfect candidate for this MAKO surgery. That's a robot-assisted surgery on the portion of the knee." He said that if I had this surgery, I'd be back in action in 12 weeks. And guess what? In 12 weeks, I was back in the water surfing. I wasn't at 100% yet. I had to do quite a bit of physical therapy to get swelling down and to get full mobility in my knee. But, it was working good. It's the winter again, so there's lots of surf. I just surfed big waves at the lane, had a good session, and, it's a great outcome for me. And I'd say that if you're the candidate for this kind of surgery, you might want to really explore it, because it's way better than the pain or a total knee replacement from which many people never get full mobility back. And I got to say, I think I got 99.9% mobility back in my knee. That's the story.